we think we're giving more of ourselves. Like, I have to give everything. But if you take a step back, if you're not taking care of you, what are you giving? Right? Are you giving more yelling, more irritability? Are you giving more under the context of I'm giving my love? I don't know. That doesn't sound like it to me. And you're arguing with everybody. You're upset. Your temper's short. Focus on you, your good habits, your good behaviors, your mental mindset. It's not about being just you, but finding that balance. But you have to create time for your own healthy habits and behaviors, for your own well-being, and so that you can radiate what you experience and what you have.
Welcome to the Everyday Epigenetics, raw, real, relatable podcast. We're your hosts, Susan Robbins, certified epigenetic human performance coach,
and Kate King, licensed psychotherapist, board-certified art therapist, and award-winning author. Together, we bring two perspectives, two styles, and one shared passion for epigenetics.
On this podcast, we delve into topics such as environment, nutrition, fitness, mindset, social dynamics, and trauma as they pertain to epigenetic expression in a way that's relatable to everyone.
We recognize that everyone's needs are unique. There are no one-size-fits-all solutions for your mind, body, and heart. The true magic lies within you.
So if you're ready to create a radiant life through epigenetics and reclaim your authentic self, then buckle up. Here we go. Welcome to the Everyday Epigenetics, raw, real, relatable podcast. We are your hosts. I'm Susan Robbins. I'm an epigenetic human performance coach, and I am here with the lovely
Kate King. I am a licensed psychotherapist, board-certified art therapist, and award-winning author.
So today, you guys have to buckle up for this one. This is going to be such an amazing conversation. I've been so excited to have this person on here, a friend of mine. As you all know, I had worked in thyroid hormone space for a couple of years. And she said, you have to listen to this doctor. I've worked with him. And she said, I think you would align with him. His name is Dr. Eric Balcavage. I listened to his podcast, the Thyroid Answers Podcast. And I was just blown away saying, oh my God, somebody gets this. And just really loved what he had to say and reached out, and so grateful that he agreed to be on our podcast today. And if you have thyroid issues, or if you know someone with thyroid issues, it's a very different point of view here. But again, one that I know I am very much aligned with as far as lifestyle and figuring out what's happening. It's not all the meds. And Dr. Balcavage is internationally recognized as a leading authority in functional medicine and thyroid physiology. He's the co-author of the Thyroid Debacle, host of the Thyroid Answers Podcast, as I just mentioned, and a mentor to hundreds of practitioners across the U.S. With over 2 decades of clinical experience, he specializes in helping patients recover from chronic hypothyroidism, metabolic dysfunction, and complex health challenges that haven't responded to conventional or protocol-based care. He also lectures and consults on topics such as cellular thyroid physiology, and I do want to talk about cell danger response because I've heard you talk about that, GI health, organic acid testing, and methylation, shaping a new standard for thyroid recovery. Welcome to our show, Dr. Eric.
Thanks for having me. I'm happy to be here.
So how did all this start for you? And how did you get into everything thyroid? Because you've got a background in chiropractic and functional medicine. How did you end up in the thyroid spectrum, just to start with?
For the most part, it happened by accident. I had a background before chiropractic school in medical technology. And so I was the person, when you ran blood work, I was the person that was running all the tests on it. But then went to chiropractic school, did the chiropractic thing, but then a family member developed a number of health conditions, and I was asked to help, and I didn't know anything about thyroid physiology really at that point. And I let them know I didn't know, and they said, you're going to fix it. And You're like, all right, let's start going back into the blood science and try and figure this out. But then as you start talking to your clients every day when you're, in the time that you're with them, adjusting them and doing whatever therapy and stuff, you have conversations. And I never really spent as much time looking at and asking people about their medication and how they felt on the medication. I separated those two pieces out. And remember, I'm in this is 30 plus years of practice now. So it's been a while. But I realized how many people were struggling with thyroid conditions and still, even though they were medicated and they were deemed euthyroid based on the medication and who they were seeing and how they were evaluating, assessing their physiology, they still looked like they had health issues and they still felt like they had health issues. It started me even deeper into the process. And so I really dug deep into functional medicine and did Dr. Karazian, did everything he had, everything Apex. I went to a bunch of conferences. That led me into functional neurology and all kinds of fun stuff. But through that process, I was doing what I was learning in functional medicine from a thyroid perspective, but something never seemed appropriate. Like it still seemed to me like we were managing conditions. We're just using supplementation. And then a friend of mine, Ben Lynch, handed me a paper as we were preparing for one of his conferences on the cell danger response by Dr. Robert Navio. And I was like, this is it. This is what's missing. And then I scoured his paper for the thyroid story, like he had vitamin D and what happens to that, and these other micronutrients and what happens to them and under homeostasis versus allostasis. And there was no thyroid stuff here. Like where's the thyroid stuff? So I reached out to him and he said, listen, I don't really know much about thyroid physiology, so I didn't have it in the book. And so this is how I realized, like, this is what I think is going on with thyroid physiology. And it became a passion to try and figure the process out. My friend Ben was like, you got to write a book. And I'm like, I don't even know how to write a book. But then we wrote a book with my friend Kelly Halderman, who was a medical physician, recovering medical physician at that time, and is now left traditional medicine. And that's where we're at today. And today I'm still trying to get that message out that there's two strategies here. One is a management strategy and one's a recovery strategy. And most people are focused on a management strategy. But I was working on my white paper. I'm going to try and put out there too, to reinforce there's another option here. We're just not doing it in large mass. And we, the functional medicine community, are the community that really should take hold of it, but we're not there yet.
Yeah. What I kept hearing, I need more T3, or I need more T4. I need more meds. I need more meds. And I go, let's delve into the lifestyle. I don't want to give this up. I don't want to give this up. Well, what do you think is driving all of this? What are the stresses like in your life? How are you handling all of that? That's what affects all these changes, especially epigenetically in the body, that are really roots to all this. And we started talking about the genetics part. So we'll get into that in a little bit. But you brought up the cell danger response. So if you wouldn't mind speaking on that so people can understand what the cell danger response is that you were referring to.
Yeah. Dr. Robert Navio took a whole bunch of the cell danger theories and put them all together and called it the cell danger response. And essentially what this is a adaptive response by our individual cells. We've got millions and trillions of cells in the body, and we think of them like just this thing all by itself that just does stuff, right? But we don't even think about it. But all these cells are in constant communication. They're all working synergistically with each other. And we've got this massive innate intelligence within the body to make and create all the drugs, hormones, enzymes that we need, depending on our state. And so what Navio was talking about in his paper on the cell danger response is that we operate really from two different modes. Either a homeostatic state where we're able to make all the things we need. We're going to make all the energy, all the hormones, all the neurotransmitters, everything we need to make under our current load of stress based on the resources available to feel and function well, for everything to run appropriately. That's homeostasis. Allostasis is an adaptive state where cells perceive threat, danger, something that's telling the cell, hey, there's a problem out here. Starvation, emotional stress, organisms, toxins. And when the cells perceive danger, and then we believe the mitochondria are the primary danger centers, there is an adaptive process that occurs within the cells to slow down the metabolism, slow down the production of peptides and proteins and hormones and neurotransmitters and energy. And we slow down the metabolism and instead shift energy towards cell defense. And that means trying to figure out what that threat is, find it, get rid of it. And then also send signaling molecules out into the periphery, into the bloodstream, to tell the surrounding cells, hey, there's danger. So they do the same thing, a cell danger response, and so that we can activate the immune and the inflammatory system, which is part of that defense mechanism. And when these cells enter this cell danger response, they stiffen their cell membrane. That means they bring less resources into this cell. They may bring less oxygen in. And there's a whole bunch of steps that take place. But what was missing from Navio's information was what helps regulate that. And that's where I've pieced together in the thyroid debacle and in most of my work, like the down regulation of thyroid hormone is the appropriate adaptive response under these threat states. And the scientific literature today confirms that. Now, it's messy because people want, oh, this does this, but the overall principle is for the cells to slow down their metabolism and stiffen their cell membrane and drive inflammatory mechanisms, there has to be a reduction of T4 to T3 conversion in the cells to make that change in that switch. And it's not uniform from cell to cell. It differs between tissue type, but in general, that's what happens in the body. And then that results in, unfortunately, the things we don't like, the signs and symptoms of hypothyroidism, the signs and symptoms of glucose resistance, the signs and symptoms of tiredness and fatigue and hormone dysregulation. And we look at these things and we say, I'm broken. And I would argue we're not broken. This is what happens when your body senses danger, your cells senses danger, and it says, hey, let's slow down the normal metabolism. Let's ramp up defense. And if you want, I'll get into the mechanisms for how that happens and why it's important for that to happen. But it's my belief that that cell danger response triggers cellular hypothyroidism, reduced conversion of T4 to T3, and it potentially, in many cases, also initiates the thyroiditis that occurs at the gland and gland damage. And we can get into whatever part of that you want.
I have a question for you. Before we go further, I think that it would be valuable just to tell folks who have been in the traditional medical model, treating their thyroid for maybe decades, that this difference between the maintenance approach and the recovery approach. I don't know that everyone is aware that there's an option, because so often it's like just a lifelong sentence of, okay, you have hypothyroidism, you take Synthroid, levothyroxine forever, maybe Armour forever, and this is your life now. So can you speak just a little bit to the difference between maintenance and recovery and kind of what that means for the average person who might not know a lot about functional medicine, and maybe also tie in a little bit about how a functional perspective of thyroid health is different than a traditional perspective?
I'll hit a couple of these pieces. But number one, everybody needs to understand that hypothyroid signs and symptoms are the result of the amount of thyroid hormone inside your cells and tissues. And it can be different cells, different tissues impacted by thyroid hormone. But when you feel tired, you feel fatigued, there's not enough thyroid hormone in the cells. In general, in allopathic medicine, traditional medicine, their primary focus is to evaluate you for when your thyroid gland can't make enough thyroid hormone and then replace the T4 that your thyroid gland can't make with enough T4 to suppress TSH into whatever reference range your doctor cares about. Okay. So there's two big issues when it comes to hypothyroidism. And that is what's going on here just a gland that can't make thyroid hormone anymore? I call this glandular hypothyroidism. Or is this or does this person have cellular hypothyroidism, which means there are tissues in the body that aren't converting T4 to T3 optimally, and therefore they're having symptomatology of hypothyroidism in those tissues. Okay. Now, if you have a glandular disorder and you can't make enough thyroid hormone, primarily T4, because that's primarily what the thyroid gland makes. It makes maybe 5 to 10 micrograms, but most of what's made is T4. It's 10 times the amount of T3. So if you don't have enough T4 being made by your thyroid gland, then the potential is all your cells and tissues are going to have a level of hypothyroidism, because if there's not enough thyroid hormone made by the gland, then there's not enough thyroid hormone in the cells and tissues. Does that make sense? So that's anybody who has glandular hypothyroidism is going to have cellular hypothyroidism if there's insufficient T4 before they get treated. Allopathic medicine assumes that if you have primary hypothyroidism, meaning your TSH is lab high and your free T4 is lab low, and I think that's an insufficient way or inappropriate way to assess thyroid physiology overall, but this is their model, so we're just going to go with their model. They're saying if you have glandular hypothyroidism and we give you T4 medication to a point where we restore TSH into a lab reference range or into somebody's perceived treatment range, whatever that is, because all doctors differ here, then we've essentially created euthyroidism, meaning that if we gave you enough T4 to lower TSH, a brain-based hormone, then all the cells and tissues now have enough thyroid hormone and you've been restored to euthyroidism. And if you're still complaining of hypothyroid signs and symptoms, two things are going to happen. One, they're either going to say it's a different condition, it's not related to what we're doing because your TSH is normal. Or two, we'll try and give you more thyroid hormone in an effort to placate your symptoms or to eradicate your symptoms. And that is the first one. I understand their model, but it's probably incorrect. And two, I understand the model of let's just give you more because more is better. That's how we live here in the United States. More is always better. But it creates significant potential problems that if we want to get into later, we can get into. That's the traditional medical model. Why don't they run thyroid antibodies? Why don't they run T3? Because it doesn't matter to their model. Their model is based on manipulating TSH into range, managing TSH. That's the model. So we can't get mad at them for the other pieces because that's what they're trained in. That's what they do. And I know I was one of the people going, what are they doing? But I understand their model. Okay. Trying to argue, Republicans and Democrats trying to argue. It's their model. They're not going to agree. So stop beating your head against the wall, right? Mm-hmm. So but there's a management model in functional medicine as well. And the management model in functional and integrated medicine is to manage T3 and free T3. And their belief is that the medical profession only looks at part of the picture. They're not looking at T3 and reverse T3 and thyroid antibodies. And so therefore they're missing the big picture. They can't see that the person has lost the ability to convert T4 to T3 and that their cells are favoring the deactivation of T4 to reverse T3. And many people in that space believe that reverse T3 is blocking T3 from binding to receptors. They have to do everything they can to raise T3 levels, lower T4 levels, TSH, who cares? Because our goal is to raise T3 because in reality, that is the active hormone in the cells. And this is though we say this is optimizing thyroid care or optimizing blood values, is nothing of the sort. What it is manipulation as well. And unfortunately, a lot of the thought process and theory that goes into why this model may work is built on false beliefs and myths. And but their goal a lot of times is to manage and manipulate T3 and free T3 and reverse T3, and they have less concern about TSH and T4. But this model is problematic too, because T3, the half-life of T3 is fairly short. Now, T4 to T3 converted inside the cells, that stays in the cells for about 8 hours. T3 from bloodstream or from your medication only stays in the cell for about 30 minutes to an hour. Okay. So if it doesn't stay in there very long, you're going to need a lot because it also metabolizes pretty quickly in the system. So you're going to need lots and lots. And the more T3 you give, the more you suppress thyroid gland function, the more you start to alter adaptive physiology. I give you a whole bunch of arguments why people might feel good on it and then feel really worse on it as well. So those are the two camps. As far as the recovery camp, that's my camp, and I'm sure there's others out there. I'm not big on looking to see what else everybody else is doing in the space, but the recovery camp and my camp is this, is that you have an innate intelligence in the body. Your cells did not forget how to convert T4 to T3. It's usually in response to something, chronic low-grade inflammation, cell stress, whether it's physical, chemical, emotional, microbial, or a combination of all those things. And more thyroid hormone doesn't fix the problem. We need the least amount of thyroid hormone to make sure we have enough T4 in the system for the cells to convert as needed, but not to manipulate numbers into a predetermined optimal range, because the body is already working optimally in most cases by saying, hey, there's danger. We're not going to convert that T4 to T3 because that would support the threat. That would support the problem. So we're going to reduce metabolism, ramp up immune inflammatory response. And so in my model, I want people, we have to make sure there's at least enough T4 in the system. If they convert more to reverse T3 than T3, so be it. That is what the cells are doing. And so instead of trying to manipulate any of the lab values, as long as there's enough T4 and free T4, then we need to get busy identifying what's creating the excessive cell stress on this person's physiology. And as we reduce and eliminate those stressors, they're going to convert T4 to T3 better. They're going to absorb more of their medication. And what quickly happens is the medication they're taking to manage a number becomes excessive. And we have to get that dose reduced, because if we don't, that too becomes part of the problem, part of the stress load on the person's physiology. Now I'll shut up and let you guys, if you have more questions, because I could go on for days.
It's so helpful. Incredibly helpful hearing you speak. I appreciate so much the integrative model of this, that it's not just one thing and that maybe there isn't just one factor that needs to be tweaked, but really paying attention to the microbial, the psychological, the emotional, all of these aspects. I hold the emotional psychological torch on this podcast as the therapist, and I think it's so influential into both kind of creating the epigenetic expression of things like hypothyroidism, but also once you're in that hypothyroid bog of feeling bad, it becomes this ripple effect where people, it's like a chicken or an egg. Did the depression cause this, or is this causing the depression? Or the racing heart, is it anxiety, or is it biophysiological? And so there are so many cognitive and emotional elements to this physical aspect that I appreciate listening to you and hearing how you integrate that. And I wonder, is there an aspect where you integrate psychotherapy for some of these patients of yours? And like, how would you know as the medical doctor when there's a need for psychotherapeutic support versus when these medications will suffice, or lifestyle changes like microbial or diet might support them? How do you resource from there?
Yeah, so I think almost everybody could benefit from some psychological support. I look in my book, I talk about the fitness factors, and we only had 8 or 10 in there, and now we've expanded that to 18. But mindset fitness, like what's going on between the 6 inches, what's their thinking process. But we also I think about emotional and psychological fitness, how we're perceiving, right, the environment that's coming at us, right? I think it's huge. In the book, we discuss MAP method, which as a strategy, Kelly, my co-author, had used MAP therapy, and that worked out really well for her. But I think almost everybody who's had chronic health issues could benefit from some emotional work, some mindset work. And it's a tough conversation to have initially, as you guys probably well know, because people to say, this is the stress every day. I can manage it. I can do it. But what they don't realize, and we often hear in their voice on the first couple minutes of a conversation, is their limbic system is wound up. And if we don't do something to calm down their limbic system, there's no way they're going to have a healthy gut. There's no way they're going to sleep appropriately. That's why we don't want to overload them with thyroid medication, because if we overload them with thyroid medication and they're in this kind of fight or flight response, you get increased conversion of T4 to T3 really rapidly, and that accelerates the anxiety, it accelerates the insomnia, and downregulates all these parasympathetic systems. So I think it's almost every person, but not everybody's ready to go there on day one. But I think it's critical. As a foundational factor, there's 5 things that I think are foundational, but mindset is huge. And I do separate mindset. Maybe I keep thinking, is it just too complex? Mindset versus emotions, but I think it's two different things to work on, but mindset's important. You can have all the emotional stress, anxiousness, and anxiety, but if you believe in your mind that you're like, I can't get better, there's not a soul on this earth who's probably going to help you get better. So we have to have a mindset that I can get better. My body's not attacking me. I can do the things. I can make these changes, but I'm depressed. Okay, that's fine that you're depressed. We'll get there. But right now you got to have a belief process, and you have to believe that you can get better. So it's critical. Okay, I wish everybody, and I do go through mindset. I go through these cognitive fitness and intellectual fitness and emotional fitness. And I'm not a therapist, but I do believe that that foundationally, a lot of what goes on between the 6 inches of our ears creates the chronic stress response that drives these conditions. I'm not a believer like, oh, this organism came and it was the only thing, and that's the reason I'm sick. Because you'll hear people say, I lived in mold 10 years ago, and I think that's what's causing my hypothyroidism today. Are you still living there? No. Okay. So you think that you're still infected with mold today from 10 years ago? Yeah. No. How about a belief that you're still infected with mold from 10 years ago today is keeping you in a chronic cell stress state, and we need to change that. And here's where maybe mold testing would help that person out. Yet that's not your issue. The actual organism isn't your issue. I have that argument a lot of time with people. Like, you think there's an organism, you believe it, you feel like you know it, but there's nothing here scientifically that validates that. What I'm worried about is what goes on between your ears is validating it to your body and reinforcing it. And if we don't change that, your body's going to respond as if you're in a chronic infection. Of course it would. Why wouldn't it?
Brilliant.
Yeah. And in looking at lifestyle, one of the biggest things I work with is chronobiology. People are out there, when you talk about environment, most people are trying to fit into an environment that isn't right for them instead of making the environment fit for them. And one of those things is the chronobiology. Even if you're doing all the right things, you're addressing stressors and you're getting the exercise, you're eating the foods, but you're doing it at times that aren't right for your body, because so much of what's going on out there is generic recommendations that everybody should get up and train first thing in the morning, get it out of the way. Well, we know for some bodies, that's actually more taxing to them. If they did nothing in the morning, it would be better for them than getting up and doing a high intensity workout first thing in the morning and stressing this body that's not prepared for that. And these are people that I see most of because they're the ones who are metabolically more prone to issues around thyroid, insulin. And we know all this runs together. So, do you look at anything as far as chronobiology, getting people in line with their circadian rhythm? If someone really has issues getting up early in the morning, they might not be that morning person that they're being told, "You're just lazy. You're not wanting to get up. It just makes you lazy. And this is why you're overweight." And this is what I see, when we tune them into how their body's created and what their body naturally tends towards, the medications part starts to take on a whole different thing, like you're saying, because you're addressing it's a big stressor on them that no one talks about is timing on things, timing of foods. I have clients that have come to me that are eating like a small meal at bedtime and wondering why their kidneys, their insulin resistance is through the roof and they can't lose weight. And yet you hear, let me get you on thyroid meds, and it's all your thyroid's not working, which is why you can't lose weight. And you put them on thyroid meds, and guess what? They still can't lose weight. But you get them doing the right things at the right times, with or without the meds, weight starts coming off.
hmm
So
And we,
does that make sense with where I'm going
yeah,
here?
I think because at the end of the day, what we're doing is we're doing bio-individualized medicine, and we're saying, okay, let's look at habits. Look, how do they jive with how you feel and function? Let's maybe change some of those habits. I get up every morning, I'm exhausted, but I work out anyway. Okay, you're already not in a state probably to be in the best shape to do it. How can we change that habit? How can we change the behavior? Like, I eat before I go to bed every night and I have insomnia. Okay, why are we eating right before we're going to bed? I'm having a cocktail before I go to bed every night. Like, it is about looking at the individual instead of having protocols, which is the I hate, what's your protocol for this? What's your protocol for that? I don't have a protocol. I have a patient sitting in front of me. We have to look at their health habits, their behaviors, their diet, their nutrition, their workout practices, their relationships. Like, we have to look at the individual and then decide what's contributing to the excessive stress load for this individual, and then make those incremental shifts in their habits and behaviors so that we reduce the excessive stress load. And it could be anything. And you're right. Like, both of you are right in what we're saying. And somebody else could say, but I'm worried about X. Well, if it's part of, yeah, if they have a terrible relationship, is that playing a role in what's going on? Yeah. Yeah, we gotta look at all, but in we just don't like complexity when we're talking about healthcare problems. We like to be very linear learning and very linear thinking in the correction strategy. And instead of looking at big picture, we like to look at narrow values of things. Let's only look at these two markers because those are the only that matter. No, you're in a management strategy. You're only concerned about the value you care about, and you believe that restores function and physiology. It doesn't, but it does make you feel good as the clinician or the patient because I got that into that range. Great, but that doesn't mean you're healthy, right? So we have to get back to, instead of this kind of linear thinking and this reductionist physiology, we have to get back to this broad picture, holistic version of a human being and how they work and how they function and what is creating the excessive load on somebody's physiology that's contributing to their cell stress response and how their body is behaving the way it is. And I don't know that functional medicine or allopathic medicine is designed or cares to do what we do in functional medicine. I think that's great. I and people may say, "What are you crazy?" The medical doctor should do that. I think the medical profession's best role is to manage disease for those people, diagnose and manage disease, and then give people the option. Like, here's the management strategy. Here's a restorative strategy. I don't do the restorative strategy, but these people do. What do you want? Are you willing to change your habits, behaviors, your lifestyle, relationships? No. Great. You're in the management box. Do you want to do it with drugs or supplements? Okay. Which is cheaper, which is faster, which is my insurance company cover? Drugs, take them. Done. We're off on our way. But if somebody truly wants a recovery strategy, a health recovery strategy, then they should be willing to say, listen, we're going to manage you with these medications, but I got to send you to somebody who does recovery. The problem is today, and no offense to my friends and my peers, is that they come to functional medicine and they believe that the functional medicine person is doing recovery-based care, and many of them are doing a management strategy with supplementation. And that's not better in many cases. Sometimes it's actually worse and more expensive. So I just want I want us to get back to what I think our roots really are, which is how do we help people recover? Let's identify the excessive stress load, and let's get them back to health. If that's what this person wants, if they say I don't want to do any of that stuff, great. Then you go into the management box. That's okay. I'm okay with it all the time.
Yeah. People are going to have what they think is going to work for them. And usually what you see or I see, or even Kate would see, are people that have reached the desperation point. They've done all the things, or they think they're doing all the things, and that there's no way out. And they're just literally desperate for any kind of help. And they've spent thousands of dollars, every supplement under the sun, like you said, some which make them worse. I have a question for you around Hashimoto's. So with a lot of the functional medicine, if you have any antibodies present whatsoever, they're automatically labeled you have Hashimoto's. What is your thought on that?
Yeah. The Hashimoto story is one that I keep talking about. So most people don't look at this correctly. But when there's thyroiditis, okay, that means the immune system is damaging the cells and tissues. Oftentimes, it's believed that it's an immune system out of control. I don't buy that argument. I'll propose a different argument, but But most people who have thyroiditis are Th1 or Th17 and maybe CD8 cell dominant, which means they've got pro-inflammatory lymphocytes that are going into the tissue or being activated within the thyroid tissue, and they are creating the damage to the thyroid cells. But they're not generally antibody producing. Okay? If people have elevated antibodies, they probably are Th2 dominant. And somebody might say, okay, that's the differentiator. Antibodies or no antibodies, really high antibodies or low antibodies. None of that really makes a difference because most of the damage of the thyroid gland is not driven by antibody-directed damage. It's directed by the inflammatory Th1, Th17, CD8 cells. So you could have Hashimoto's thyroiditis and absolutely no antibodies. You could have Hashimoto's thyroiditis and have massively high antibodies. You could have antibodies and no actual thyroiditis going on.
So people that are just diagnosed, you've got, it's showing a level of 3 antibodies.
You could have worse thyroiditis.
Hashimoto's.
Yeah, but you already have it. The differentiator between Hashimoto's and traditional thyroiditis is just the antibodies. But people swing from Th1 dominant to Th2 dominant in the process of their immune life. And so, your antibodies can go up, they can go down. But if they're stuck, and hey, it's been test after test after test, and my gland's not working, it's not producing hormone, but I don't have Hashimoto's. Of course you do. But you're probably Th1 and Th17 dominant. So you're not making a lot of antibodies. So you're not seeing it, but it doesn't mean you don't have thyroiditis going on. Just labeling it Hashimoto's or not is stupid. It's thyroiditis. If there's antibodies or no antibodies, it doesn't make a difference. There's still thyroiditis going on. So the whole argument that we need to run antibodies to confirm they have Hashimoto's, no, you You want to know if they have thyroiditis going on, Hashimoto's, not Hashimoto's, run a Cyrex lymphocyte map test and look at their T cell population, Th1, Th17. You can look at the Th1 to Th2 ratio, Th17 to Treg ratio. You can look at their CD8 positive T cells. You can look at their natural killer cells, and we can get an idea of what's happening with the immune system. But the BS about antibodies is it's another one of, it's like the reverse T3 myth. It's just a story that people talk about, but it's not. It's a story, but it's not the story. Definitely not the story.
People's minds are their brains are exploding right now.
Yeah, I listen. I hear it from clinicians. They're like, but my patient has everybody. If they don't have iodine deficiency, they have thyroiditis going on. You call it anything you want. You can make it as complex. So we have 27 different types of thyroiditis. It's thyroiditis. Now, if you want to have a real conversation, let's argue about why are they Th1, Th17 versus this person who's Th2, right? And why is that shifting? We don't all know that answer, but the thyroiditis is being driven. And we could also have to argue is the thyroiditis being caused by an immune system out of control, or is the immune system being directed to damage the thyroid gland adaptively? And I would argue it's the latter. It's not broken physiology. How do I know? Because I'm a guy who's had two autoimmune conditions. I don't have either one of them, Hashimoto's or Raynaud's currently. And I have patients all the time that are diagnosed with an immune system that's out of control, that's causing destruction to your gland. But if that's the case, you're screwed. Like, you're not going to fit. If your immune system has truly lost the ability to identify self tissue, if you're a scientist, a clinician, or a patient who believes that your immune system no longer can identify your own thyroid cell tissue as self, then you're screwed. There's nothing you're going to do to recover your thyroid gland. But I don't believe it. And I don't think the literature points that out. And it does. 30 years of doing this doesn't prove it out either, because as you identify the stressors and reduce them, and then start working on reducing the excessive medication use, guess what happens? Their thyroid antibodies go down. Their thyroid production goes up. Their conversion improves. So if it was an immune system out of control, then the answer should be suppress the immune system with steroids, which we're not doing, or two, remove the freaking gland, which they do. And guess what still happens? They take the gland out, they put thyroid hormone in, it still doesn't work. Why? Because it was never the immune system initially destroyed, that lost control.
Mm-hmm. We need to keep updating, like the information that comes through research and different studies around this need to continue to update and change and grow and integrate new information. And when we find out what's not working, I think it's really important for the medical community and for the patients to really advocate for their own health by saying, whoa, isn't there new research around this for a different way that we should be doing this than I think most people who have hypothyroidism or other thyroid conditions, their mother had it, their father had it, their grandfather had it. And maybe I have a question for you if this is a myth, but someone, I think it was a physician a long time ago, told me that if there's a male in the family who has hypothyroidism, all of his female descendants are 12 times more likely to have it. Is that correct?
I don't know. I haven't seen that written anywhere, but I'd be interested in seeing the paper that has it. But I definitely think genetics play a role for sure. Epigenetics play the biggest role. I know we get caught up on the genetics, right? Hey, I got my genetic report. This says I'm deficient here. I'm deficient. I need this cofactor. I need this cofactor. Wait a second. And that's where Ben Lynch wrote his book, Dirty Genes. He's like, all right, wait a second. Let's take a pause here. Hey, we can't change the genes. Yeah. And when I was working with Ben and we were looking on his pathway planners and all those things, and what led me to Ben was I was reading all the earlier stuff on genetics, and there's these long lists from people who are supposed to be epigenetic specialists. And then everything on their list was like massive quantities of supplementation. Like the real way to fix this was to give more micronutrients. But then you'd be like, wait a minute, if they got all of these micronutrient deficiencies, then they have a diet issue, they have a malabsorption issue, they have a dysbiosis issue. And two, doesn't how the state of the cell determine how these micronutrients are going to be used? And that's where, and even in those same reports, you'd say, if you have this SNP, you need to add B6. Then you go down a little bit further and you go, if you have this SNP, you don't take B6. Okay. All these are protocols that don't make sense. They're great to sell people reports and supplements, but they don't make sense in reality. But the other piece of that is, we want the things that we do that make sense to us on paper to work in the cells the way we want them to. And they often do not. And people will say, I'm allergic, I'm sensitive. You know what? I don't think you're allergic to that micronutrient. You've got so much B6 that you've used your whole life. I don't think you're allergic to it. The problem is, you're putting something in there with an intended you want this to happen, but your cells and tissues are going to do with that micronutrient what they want. They may use that micronutrient to make more pro-inflammatory molecules because they have a cell defense process that's dominant. They may use those micronutrients to make more hormones and proteins because the danger physiology is over, and now they can use that for recovery. Or you may put that in and its body can't use it, and now it has to use energy that it doesn't have to get rid of this stuff because it doesn't become problematic. Or we put more stuff into a system that we can't utilize, can't metabolize. And where does it have to go? It has to go into fat storage, contributing to more weight, more adipose-driven inflammatory process.
Now, me doing DNA testing, I've been doing it for 5 years. It can be super helpful. Now, you have where you can order a kit online, and then you get your report, and it just, here's everything you need. And it'll tell you, avoid these foods and take these supplements because you've got MTHFR, right? So you have to do this, and you have to take large amounts of folate, methylfolate, and large amounts of trimethylglycine and B12. When I do DNA testing, I don't release the report to my people until we've met, because the genetics are probabilities and propensities, not absolutes. And what I think what you're tapping on here is, it's the expression. Now, my Dirty Genes book is one of my Bibles, and that's really what we talk about is the expression. Because just because you have a propensity for something doesn't mean it's actually going to express. And what are the things that are lifestyle driven, not necessarily supplements? I work with people to get them off a bunch of the crap that they hear on every podcast and every influencer saying, you need to take this and you need to take this. How many people have a freaking supplement graveyard full of crap they've just heard is good, and they don't even know why they're taking it? I ask, why are you taking this? I have no idea. So when we look at it, is this expressing? What do we need to do lifestyle-wise? And again, stressors, chronobiology. What are the foods that you need that are based on nutrient density, not just this basic protein, carbohydrate, and fats? What's your home life like? Is your home cluttered? Is it not? Things that like no one really talks about that you don't get in a standard DNA report that just says that's your genetics versus the genomics is through the lifestyle to try to get those genes to express as you want to, as opposed to just, here's what you need, take these supplements and call it good. So I think that DNA, when done properly, can be super useful. And some people need that heads up. Oh, wow. If I go this direction, probably not the best. I'm high risk for Alzheimer's. Probably a good idea not to drink, right?
Yeah.
So that's where I think it can be super helpful, not to scare people into something or thinking they're going to get something, but also just because you're not genetically prone to something doesn't mean that it can't happen. So it's just how you use those epigenetic tools. And I think that's where you were going with that.
Oh, absolutely. I think the genetic information could be really helpful. Okay. But I think it is a tool, not the tool. And there's a timing, I think, that comes along from my perspective. If somebody said, listen, I've got chronic health issues, I want to run my genetic report right off the gate, I'll be like, okay, hold on a sec. Let's talk about what your diet is, what your lifestyle is. Let's work. And if they ask me, everybody's saying you need to know your genetics. Like, you need to know your epigenetics long before you need to know your genetics, because the epigenetic influences are going to take a bad gene and make it worse, or a good gene and make it not function well. And I always usually give an analogy of like a 1-lane highway versus a 8-lane highway. Which one works better? The 8-lane. What happens if there's an accident on that? That's worse than the single-lane highway without an accident. It is, but I think it's important. We've said this a couple times. It is the epigenetic influencers that are going to have the biggest impact. I have people that get their genetic report like, why are you eating like this? Because somebody gave me a genetic report and said, this is how I have to eat based on my genes. I'm like, what? Like, they don't know that, as you said, these are possibilities or probabilities, but they're not definitive. And right now, you're eating this style of diet. You don't have the metabolism right now to use this style of diet. Like, how are you going to do that? That's why you're frustrated in that model, because somebody's looking at genetics, assuming you're in homeostasis, and this is what will make it work. You ain't in homeostasis. Is that genetic factor going to be compromised even maybe more because of that? Sure. Does taking more micronutrients make it work better? No, because you're in an allostatic regulatory state. Dress, life, and lifestyle. And I know it's not sexy, and people want to feel better first. You think it's not right to give them stuff to make them feel better. Look, I get it. Small amount. If my argument to like T3 medication is, if you fully destroyed your thyroid gland and you have full T4 replacement and your thyroid gland's doing nothing, you probably need 5 to 10 micrograms. That's it. And probably 10 in a split dose, 5 in the morning, 5 in the evening, to optimize what your gland would make. That's not there anymore. But if you still have reduced conversion and we keep ratcheting up your T3, could you feel better? Temporarily, sure. But doesn't somebody who does cocaine or alcohol or any other drug, they get the initial hit and they go, that was awesome. And then what are they doing? They're constantly chasing it, right? Because the body's going, we don't want this. We're trying not to convert T4 to T3. And somehow it keeps winding up in here, and it's problematic. And one of the big reasons it's problematic, if we think about what those cells in danger, what are they doing? They're down-regulating mitochondrial density, meaning I don't want as many of these engines in the cell to make energy. I'm going to reduce the number of them, because these engines produce a bunch of free radicals and oxidative chemicals that could potentially damage the cell. And I don't have a limited amount of antioxidants I can make within the cell. So if I stiffen my cell membranes and I don't bring the nutrients in to make more antioxidants, and I'm creating free radicals because of an organism or a threat or inflammation, and I have the mitochondria going at full tilt, more thyroid hormone just increases oxidative stress that I can't manage and potentially creates more issue and problem. So we just need to be very cautious and careful as we're doing stuff. But yeah, I want people to feel good, but I also don't want them constantly chasing it with a drug. I'd rather spend my time working on those epigenetic factors to lower, not just help their genes work better, but to reduce the overall excessive stress load. Yeah,
absolutely. We'll see changes, just lifestyle, in 1 to 2 weeks. People feel better without changes in medications or anything else. So there's your evidence.
Yeah.
Right. And that it's not just about the meds. If you start, and I always say, start with the lifestyle. If you need to work with someone to bring meds in later, but if you don't begin with the most important part of that complex system, which is your foundation, your epigenetics, your environment, and your lifestyle choices, and every choice matters. And on that DNA point, I don't coach. I don't have any coaching programs based on DNA. I won't coach off of it. I'll do a report, a one and done, or within a full program that works on everything lifestyle, but I won't even coach just off of DNA.
Yeah.
It's,
And
it's just not
I think I think that's wise, because I think looking at the genetics is really a skill set in looking at the big picture and being able to say, yeah, that's probably not an issue for you. Don't worry about that.
Yep.
Don't worry about that. Don't worry about that.
Yeah.
I need to do this because I have MTHFR. Yeah, but if we look at your folate metabolism, you don't have an issue. You don't have a problem with your methylation. So don't worry about that. Just scratch that off for right now. We could deal with that later in the future. And a lot of things people don't know is, guess what you need? You need appropriate levels of T3 in the cells and tissues to actually do methylated folate to convert folinic acid into methylated folate. So you could, if you have an MTHFR issue and you have cell stress going on and you have reduced conversion of T4 to T3, it may be the inflammatory cell stress mechanism that's having a bigger effect on your ability to methylate than your need to take methylated folate. I do want to say one thing.
I think that was me.
Because it's really important when you're talking about what you're doing. Hey, we do life and lifestyle changes, and we see people's signs and symptoms improve. And I think that's really important to say. I do want to make one caveat too, because I'm sure it's happened to people who are listening to this, and it's probably happened to some of your client base. As you start to make those positive changes, the load of medication you're taking today is quickly going to be excessive, because you're going to have better digestion. You're going to absorb more medication into the system. And people either hit the stall, what I call it. If you're, I'm a barbecue guy, so I like smoking stuff but when you're smoking a big piece of meat, it hits the stall at times. And you're like, what the heck? The temperature hasn't changed in 6 hours. That's the stall. And everybody should keep an eye out for the stall or the reverse of things, because otherwise you're going to be stuck in what I call thyroid purgatory, which is, I feel better than I did when I got diagnosed, but I don't feel as good as I think I should. But everybody says I'm optimal. That's thyroid purgatory, as everybody's kind of gaslighting you, that the medical doctor's gaslighting you, your functional medicine practitioner's gaslighting you. We've optimized you. We've optimized you. Yeah, okay. I don't feel optimized. So that you don't get into thyroid purgatory, or so you can get out of thyroid purgatory. When you start to make these life and lifestyle changes, you're going to absorb more of your medication into the system. You're going to start to convert it more. As soon as that medication becomes excessive, what's going to happen? You're going to have a slowdown of your improvement. Your weight's going to stall. Your symptoms are going to stall. They're not continuing to improve. Why? Because now, as you have too much T4 in the system, that reduces the peripheral intracellular conversion of T4 to T3, actually making you more hypothyroid in your peripheral tissues, but actually making you more hyperthyroid in your brain. So you'll have more anxiousness, more anxiety, more brain fog, more tiredness, more fatigue. And you're going to go, Susan, I was doing good. I don't know what happened. Everything went down, but now, your program's not working for me because now I'm starting to feel terrible. No, Jane, what we need to do is now we need to go get a thyroid panel done quickly and see where those values are, and see if now, because of all these great changes you've made, your dose has to be reduced.
Yeah.
Okay. So one of the biggest things I see in people is they're chasing the numbers instead of paying attention to the changes. When you're doing good with this coaching, like that you guys are probably doing, same for you, Kate, as you're working on the mental, emotional piece, and that person's like more at peace, and then all of a sudden, like, now I'm anxious. Now I can't sleep. Don't jump to now I have anxiety or your treatment's not working. What we should be saying is, yeah, but 2 months ago, you were on 100 micrograms of T4 and 10 or 15 micrograms of T3. You probably don't need that now, because you have less stress on the system. The fact that their signs and symptoms were getting better, their weight was changing, their waist and hip measurements were changing. And let's face it, a lot of times the thing they want to change is the weight, but it's not the first thing to change. I always say, look, that's going to come. You can't burn fat effectively until you're out of stress. So when your brain stops perceiving stress, you're going to start burning fats more efficiently, and the adipose tissue will change. But right now, we want to see waist and hip measurements maybe, and improvement of HRV and signs and symptoms. But once they hit
Love
that
HRV.
plateau, that's when we have to say, let's get that panel rechecked. The solution is probably less medication, not more, especially for those people who are like, I'm tired down on fatigue. I think I need more. The trap in allopathic and functional medicine is to give more because they have the symptom versus no, they were doing good. Now they're starting to get fatigued. Now we're probably over medicated.
Mm-hmm. I think it's a really cool approach of sometimes certain things have to happen first so that things can happen next. Thinking of it as more like a journey instead of a box that you check. And
Absolutely.
sometimes it's a reductionist model, like you're saying. We have this perspective. I don't know if it's just in Western medicine, but we have a perspective that more is better, and that if we're not feeling well, we need more of something. Or if your life's not going well, you need more something, more workshops, more therapy, more relationship, more supplements. And oftentimes, it's actually that you're overtaxing your system, whether it's your emotional body, your physical body, any aspect of yourself. And there's a subtractive element to health as well. And I think it's really important people remember this. Sometimes you have to take things away so that you can then fill that space with the energy of your life instead of filling it with just more supplements, more medications, higher dosages. So I remind myself this personally as well. Sometimes things have to happen first before something potentially unknown can happen. And you don't have to know. I'm a mogul skier, and so I often think about looking 3 bumps ahead, right, for my next turns.
Mm-hmm.
That's not necessarily how life has to be or how health has to be. Sometimes you just need to be in the moment you're in and reducing your medicine or taking your subtractive elements to whatever is happening so that later you can figure out what comes next. You don't have to know that. If you have a team that you trust, if you have physicians like yourself, it's important that you trust them to help you figure out your next steps. And you don't have to be so anticipatory and predictive of what your future looks like. You just have to be in your present moment. And really, I think that's the only way that we can chart our course.
Yeah, I agree. I think that was well said. I think many times we are so busy mentally, emotionally, physically, social media or whatever, that we're not really paying attention to what's going on inside. And sometimes taking things away allows us we are always like, what can I add? What can I add? What can I add? But you're right.
Yeah.
Many times it
Yeah.
is, what can I take away? I have to do. No, you don't have to do anything, right? There's probably somebody who can do whatever you're doing 80% better than you. And I don't have money for that. You don't have money for the chronic health problems you have today. So how about we come up with a strategy, right? Even there's goals in our life, business life, right? I'm sure for you guys where you're seeing so many patients in a day and like, blah, 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 and I don't have time to get this done and get that done. See less people. I need that.
Yep.
Well, you won't see the business opportunities or see your true direction. And sometimes until you step back and you create space for your brain to say, okay, now there's availability. It's like your closet, right? How every time you get rid of a whole bunch of clothes, what happens? The closet seems to magically fill back up, right? Because the
So
universe
true.
doesn't like a void. And I had a hard time with the whole mental and emotional stuff, probably from my upbringing and everything that happened. But probably one of the best things that happened to me was not doing more stuff. It was, and regardless of what anybody thinks of hunting, I took up bow hunting. When you're bow hunting, you're sitting in the woods by yourself for hours on end, right? And you would think this is awesome. For me, the initial I went out, I was like, okay, I'm going to try and get something, but I couldn't sit in the woods for an hour or two. I'd be like, I got stuff to do. I got to go. Like, I'd be anxious. And then one day I was like, if I can't sit by myself for 8 hours, what is wrong? I think what happened for me was I wasn't willing to listen to those voices. And when you're sitting by yourself, the noise gets loud. And if you're not on video and you're not on Instagram and you're not doing these things, which you're typically not doing when you're sitting in that stand because you're waiting, you don't want to miss your opportunity. It was really like an aha moment for me, like doing less, like taking 8 hours or 2 or 3 days away from work and helping other people was really my therapy and helping me, which then allowed me to see more opportunity to be able to help more people and how can I change my message. So I don't know how I got onto that tangent, but I think to Kate, to your point, like it's not about more. It never is about more. It's about doing less and really internalizing what you're doing and how it impacts you, and then using those thoughts, feelings, and observations to guide a different course. Many times people don't even realize they have bad habits and bad behaviors because they just do them so often all the time, they never think about it.
Yeah.
Yeah, it's about the balance aspect, and
Mhm.
Yeah.
sometimes it is subtractive to find that.
Yeah.
People use busy as a badge. I'm so busy. I'm so busy. I don't work Fridays. That is just a thing for me. That's my day. And I'm happy. I go hike or some of my friends think I'm nuts. I'll go out on my paddleboard. I'll look down at my watch. I'm like, all right, quarter mile today. This is good. And I've paddled for 13 minutes, anchored down. I sat out there on the lake, in the middle of the lake the other day, total peace and quiet for 4.5 hours.
Mhm.
Just, it's to be able to have that sense of peace about you. I've heard it from a lot of clients. I can't sit in the silence with myself. I don't want to hear my thoughts. But if you don't hear those thoughts, you can't get past those thoughts that are causing you this stress that is throwing you so out of homeostasis. Why are
Mhm.
we Kate and I, our podcast last week was on fear. Why do we have such fear around ourselves, of listening to ourselves, hearing ourselves? That's the only way you get these how did you say it? Where we get these signals coming in. You don't get that when there's so much noise, but
Yeah.
sitting in that peace. And I have been out bow hunting with my
Mhm.
ex-husband.
There you go.
It's
But yeah,
brutal.
but whatever your
I'll
thing
take the
is,
soundboard for
right?
that.
Yeah. But if your thing is
Yeah, whatever it is for
paddleboarding and
you.
you're by yourself for 3 or 4 hours or an hour, you're still able to play with your thoughts. You're not on your social media, you're not on your phone, you're not on those things. I think the reason we have such a problem today is because we spend way too much time downloading everybody else's issues and challenges
Yeah.
and diverting from thinking about what's going on in our own mind. And because we never deal with it from a conscious standpoint, it's still impacting us from a subconscious standpoint, still winding up the limbic system, still causing chronic cell stress, causing chronic downregulation of our parasympathetic. So we got hormone dysregulation, chronic gut issues, all these issues. And we're trying good protocols, especially if you're thinking about diet, nutrition, and supplementation. Hey, I'm trying these protocols. These are on paper. These should all work. Why aren't they working? Is my doctor bad? Are these supplements no good? No, the terrain is one that's in a sympathetic dominant state because of your other habits or behaviors. Is it my H. pylori? Is it my blastocystis hominis? No, those things are growing in an environment
Just
that's
out of
conducive for
balance.
them to grow. Let's look at this low hanging fruit stuff that's almost free to work on that you're not willing to consider.
Yeah.
And you mentioned HRV earlier. I love working with HRV. I've been really getting into this. Do you like to use HRV to see where someone is as far as their sympathetic, parasympathetic, how they're recovering? I think it's a fascinating tool.
I like to look at it as a tool, not the tool. And because some of these things measure very well, and some of these things probably not so well. There's lots of variability in these things. But I think for the average person, if they have a tool like that, they have an Apple Watch or an Aura Ring or something that measures it, great. Let's use that data. But let's not just use HRV. Let's look at
Right.
what's your resting heart rate? What's your sleep studies? What are your labs look like? So it is a tool, But the nice thing about if you look at HRV, especially if you go back and look at somebody's Apple Watch history and they go, I just got diagnosed. I just started having problems like two months ago. All right. You got an Apple Watch? Yeah. Okay. Let's go look at your data from a year ago.
Yeah.
Okay. 8 months ago, your HRV was 50. And then the following month, it was 30. And it hasn't gone above 30 since then. You got diagnosed with the condition 2 months ago, but you started creating an environment to create that dysfunction and disease 8 months ago. So tell me what was happening 8 months ago so I can get a better feel for what's going on. Oh, okay. So let's talk about work stress, life stress. I found out my husband was cheating on me and then we were going through a divorce. Yeah. So between the stress load you had pre-husband cheating on you, the husband cheating on you just pushed you into an excessive stress response and you haven't recovered since. So yeah, your sex hormone dysregulation is an appropriate adaptive response to chronic cell stress. Your thyroid diagnosis is an appropriate adaptive response to the chronic cell stress. The reason those 4 gut protocols haven't worked so far is because you're still stuck in the cell stress response, right? And you're trying to force the physiology. Let's go back. Not only do we need to get your mind right about what happened from a relationship standpoint, but we also have to consider what was on the stress load before that, because you were already at capacity or close to capacity. Because if we just the divorce is over, we can help you with that mental, emotional mindset piece, but we also now have to reduce those other stressors that were manageable before. But right now, those have to be lowered now too. What do you mean I can't train as much? If you're healthy, you could train this much. You're not healthy. This excessive training right now is keeping you stuck in this danger physiology. That doesn't make sense. Exercise is good for you. It doesn't make sense. Trust me. Let's knock it down a little bit. Let's reduce it a little bit. Okay, what about this? What about this factor? Oh, it's not a big deal. I was doing that before I got sick. Yeah, but right now you got to reduce that so that your body gets rid of the danger cues. And you want to call it danger, you want to call it fear, you want to call it stress. Like the term I hate, I'll figure out how to do it. But stress, everybody thinks is just like emotional, but it's so much more than just emotional. But these are the things that really foundationally we need to consider, but HRV can really help us tell a story, but we got to be careful with the person like, my HRV is usually 40 and it was 26 today. Yeah. What'd you do? I didn't have a good night's sleep last night and I started a new supplement yesterday and okay, call me in 3 days.
Yeah.
Hey, it went back up again. I gave you a supplement that is changing your chemistry. Maybe it was just a supplement, but your body is adapted to it. It's 3 days later, you're still taking it. Your body adapted to it, right? Sometimes we see when we do things, especially antimicrobials, their HLV will drop. People are like, we're not, one day doesn't tell the story. We want to look at the pattern over time.
The average.
Right? But yeah, we can look at the HRV and say, something's going on here. Or, hey, this is really high. It's one of your highest points. Tell me what happened the last 3-4 days that may have contributed to it. Why can't we do more of that?
It's like a measurement for the mind. So often our mind needs some proof of what's going on, and
it is.
These wearables are really helpful for people who need evidence. But I think it's also important to leave your wearable on the night table for a few days and go into life and just see how you feel. Try to remove that ego mind that's constantly trying to protect and control and shape you, and just ask yourself, am I grounded in this moment? How's my heart rate? Do I feel energized? Am I receiving love? Am I able to enjoy the food that I'm putting in my body? So often, for me, my signal is I feel this engine inside my chest sometimes that's propelled by probably a combination of my type A personality and some old patterns that I'm currently working on. And I'm doing a Joe Dispenza kind of process right now, which is really helpful for beliefs and mindset and stuff.
Mm-hmm.
And so I'm aware of this engine and I just feel it sometimes. And I ask myself, in this moment, what am I thinking, feeling, experiencing that is activating that perhaps doesn't have to be. And oftentimes I'll be noticing I'm thinking about meetings that I don't have this week. I'm thinking about next week's schedule, or I'm thinking about the stress of currently it's like getting my kids home from sleepaway camp and suddenly my life is going to get so busy. But they're not here right now. They're in sleepaway camp right now. Right now, today, I can be here in the present. I have more spaciousness. Am I there? Am I enjoying it? And I don't need a wearable to tell me when that is revving because I'm starting to sink into it in the present moment. So I think it can be a balancing act maybe with our technology. We have these tools, they're helpful for the mind, but sometimes in our technological world, it's about taking some steps backwards and reimagining our humanness and getting to the point where you can sense your own body without someone
Yeah.
else or some technology telling you. And then you can go to your physician, like you, Dr. Eric, and be like, hey, this is how I've been feeling lately. This is what I'm noticing rather than what my watch has been telling me.
Yeah, absolutely. I have a lot of patients that they have them, and I'm like, you're probably not the person to wear one. Take it off. You're trying for perfection on your thing, and then you're stressing because you're not in perfection mode based on that. And by the way, that thing's probably not as accurate as you're putting your belief in. It's a tool, not the tool. So there's lots of patients. I'm like, I don't think you should wear one. Matter of fact, you're wearing three. You're definitely creating stress. There's people that are wearing their Whoop, their Oura Ring, and their Apple Watch, and they're like,
Yeah.
these aren't the same. Like, right, they measure stuff differently. Stop stressing about it. Take them all off and just be, right? So I think that's perfect, Kale. It sounds like we've gone like a little woo, but the reality is we need to spend time just being and less time doing sometimes, and just be. Like, who am I? How do I feel? How do I function? What thoughts are going through my head? We just don't allow for that time today without trying to fill it with something. But yeah, I think the more we find that quiet time, and for anybody who's, "Well, I don't have that kind of time. I got kids, what?"
You create it.
Yeah,
You
you
create
only,
that boundary of your time.
yeah, you got to do it, even if it's 10 minutes. If you, because what that would tell me is
Start
if
with
you don't have,
5.
yeah, if you don't have time to
Yeah.
create for your quietness, you don't have time for that. There's a whole bunch of other things you're not making time for yourself, and you,
That's the issue.
yeah, you
Yeah.
can't,
The body's gonna stop you. At
yeah.
some point, the body will shut you down.
And
You
we
get
think we're,
sick, injured.
yeah, we think we're giving more of ourselves. Like, I have to give everything, but if you take a step back, if you're not taking care of you, what are you giving? Right?
Mm.
Are you giving more yelling, more irritability? Are you giving more under the context of I'm giving my love? I don't know. That doesn't sound like it to me. And you're arguing with everybody, you're upset, your temper's short. Focus on you, your good habits, your good behaviors, your mental mindset. It's not about being just you, but finding that balance. But you have to create time for your own healthy habits and behaviors, for your own well-being, and so that you can radiate what you experience and what you have. So many people want to radiate, they think they're giving, but they're not really giving, like, real happiness, real joy, real
Mm-mm.
positive force. It's
Yeah.
people are like, yeah, they're with me all the time, but they're always yelling at me, they're always arguing with me, right? They're it's not
A great
it's
point.
it's not the
Yeah.
right it's not the
And
right
it's
force.
that's the subtractive approach that we were talking about, right? Sometimes you have to give a little less or show up a little less. So it's really full circle, I think, when it comes to the balance of the technology versus the mindfulness, the Western medicine versus the Eastern medicine, the holistic perspective. All of this is bringing us to, I think, the last question that we have for you today, which
Sure.
is the way that we like to end our podcasts, and it's how we like to bring it back to you personally because you've shared so much expertise with us, clinically speaking, but for you personally, so much of what Susan and I talk about here is how to cultivate a radiant life through epigenetics. And that happens today, right now, in this moment. And so our question for you is, what are you doing in your personal life to cultivate a radiant life through epigenetics?
Oh, I think 80% of what I do is focused on that, right? Habits. My habits are pretty consistent. I'm a pretty well scheduled guy. So start 5:15, 5:30 starts with about an hour, hour and a half of working out, and then followed by good nutrition for the rest of the day while I'm working, micro breaks through the day, try to be quality time with family when we're together, and making sure that, hey, the the things that I lay out from a habits and behavior perspective are being done for me as well daily, habitually, right? I think I try not for perfection, but 80% good habits, 20% bad behavior is probably what makes people happy in everything. So if that's my goal. So by doing those things and balancing a lot of these good habits and sometimes bad behaviors, but things that create joy. Okay, you go out, it's somebody's birthday. Hey, I'm going to go out. I had a cocktail with my friend. Is alcohol toxic? Absolutely. But did I laugh my butt off in the time that I spent with that person? Yeah. Did it bring joy? Yeah. Did I do it excessively? No. Great. Have fun, right? That food wasn't that healthy. Yeah, but 85% of the time I'm eating a healthy, full whole food based diet. So I think I continually do my best to live what I'm trying to project to my clients: quiet time, personal time, intellectual well being, physical fitness, emotional fitness, mindset fitness, habitual fitness, respiratory fitness, always trying to, where am I here? How can I improve? So I think epigenetically, all those things that I do on a consistent basis are allowing me as almost 60-year-old dude to still be in a pretty healthy state, especially compared to my peers.
Well, yeah, I'm in the same age range as you are, and same. I had an argument with someone, little argument with a classmate. Yesterday was the anniversary of the graduation, and he said, "My God, we're 60. We're old. I'll be 60 in October." And the one guy and I said, "You're as old as you feel. I don't even have that, like, in my vocabulary." And the other one said, "Susan, face it, 60 is old." And I said, "In what? For what? How is it old?
Yeah.
I'm out performing like crazy." If you want to look at a number and let that form your thoughts around that, that's on you. And guaranteed you're not gonna have as high quality of life around because you're focusing on that number and feeling old. And anyway, so if people want to work with you or reach out to you, we will put all your contact information in the show notes, and any links that you want, make sure you get those to me so we can make sure all those are in their show notes. But if people are interested in working with you, how could they reach out to you?
They could go to drericbalcavage.com, which is the website, and there's a place in there to schedule a complimentary discovery call if you wanted to talk about what's going on. Instagram, I think, is where my team posts most of my stuff. So they can always DM discovery and they'll send them the link for a discovery call. And for clinicians who want some help thinking this way or need some guidance, like that that support is coming too. I do for clinicians, I will help them interpret labs and stuff so that I can be like, okay, this is how I would look at it, how I would address it. Then I don't want their clients. What I want them to do is learn a different way of thinking. Here's how I would do it. Now go put those things into action. We can come back and look at it. And we did an introductory clinician course, but I'm in the process of kind of making that much better. And the initial one was a kind of a starter process once we had the book done, but it'll be more involved here in the next year.
Awesome. We are so grateful that you came on with us today. And there were still a lot of things that we didn't even get to cover. So we would love for you to come back on again and talk
Sure.
more about the things that we didn't get to because it's been such a fascinating conversation. But thank you so much for your time. But keep doing what you're doing. Everything we've talked about, it's all the tools. And it's like you have a toolbox. Not one tool works for everything. And the body is a complex system. Use the various tools to get to that cause of why this body is so out of balance. And that's what we concentrate on. I have Hashimoto's, I'm hypothyroid. Okay, your body's out of balance. And why? So we put it all together. And thank you so much for your wisdom. It's been so enlightening. And I'm just fired up to go out there and do more work. So
thank you. Thank you so much. Great to meet you. Great to have you here.
Thank you, ladies. Appreciate it.
Thank you so much for tuning into our podcast.
If you enjoyed this week's episode, we'd love for you to share it, leave a review or comment, and subscribe wherever you listen to podcasts. Help us get this information out to everyone who could benefit, and we'll keep bringing you the content you crave.
You can also check out our podcast site at everydayepigenetics.co and sign up for our newsletter to stay updated on upcoming episodes. The link is in the show notes.
If you're interested in DNA or epigenetic coaching with Susan, or Radiant Life Coaching for deep inner work with Kate, our contact info is in the show notes below.
Now go and make it a great day and let your most authentic self shine.